Science education, feel this too. Molecular Mom's got it all for you.
Hi everyone, thanks for joining me today. So today I'm going to be talking to you about medication response testing. You may have heard of this. It's often referred to as a drug response test, medication response test, pharmacogenetics, maybe pharmacogenomics, that you may have heard of this. If your doctor prescribes you medications, many of these medications do have some guidance based on what your DNA looks like. So if you have certain mutations in particular genes, it can tell you or predict what your response to a particular medication will be. Now, not all medications have this, but just some do have some guidance. So why do we do medication response or pharmacogenetic testing? Well, we do this because of adverse drug reactions. So adverse drug reactions are very common and they're costly. There are over 2.2 million adverse drug reactions each year in the US. And over 100,000 of these adverse drug reactions actually lead to death. So that's pretty significant. And 3 to 7% of all hospitalizations are actually due to adverse drug events. So it's very important that physicians, when prescribing medications, that they understand what the risk is to their patients. And part of that risk prediction can be to use a medication response test like a pharmacogenetics testing. And there are many different tests that are available out there for different types of drugs. You could have a psychotropic panel or cardio panel for heart disease drugs that you may take. And there are cancer panels for chemotherapy drugs, among others. One of the main ones that's out there that a lot of people have heard of is called GeneSight, and that's a test from Myriad Neuroscience, Myriad Genetics, that they offer that is focused on psychotropic drugs. So a lot of people are on Xanax or other antidepressants, and that particular test can help a physician or a psychiatrist to guide their dosing and what drug to choose for their patient, which one their patient is most likely to be effective in their patient and to reduce the risk of these adverse drug reactions. So how does this test work? So just for basic understanding, the liver is the main organ that's responsible for metabolism of many ingested drugs or medications. And the enzymes that are responsible for the metabolism of drugs are typically called cytochrome P450 genes. These are in the liver. They're a family of over 50 enzymes that metabolize drugs. They're part of the body's powerful detoxification system, and over 50% of all drugs are primarily cleared by the cytochrome P450 enzyme family. So the most commonly targeted genes are genes in the cytochrome P450 family. The most common ones that are tested for are variants or mutations in the CYP2D6, CYP2C9, and CYP2C19 are the three most common that you'll find tested for these pharmacogenetics or medication response tests that you can get. So pharmacogenetic or medication response testing is really an important tool for personalized medicine today. It examines genetic changes in these enzymes that participate in drug transportation, drug metabolism, and drug clearance. And also, so this testing aids in your physician's ability to make sure that the drug has therapeutic efficacy and to help avoid these adverse drug events or toxicity avoidance. So genetic variants in genes that are involved in drug metabolism can have different effects on enzyme activity. So they can have significantly increased activity, a slight increase of activity, no impact on the activity of the enzyme, a slightly reduced activity, a significantly reduced activity, or could completely eliminate the activity. So depending on what type of change you have in a particular gene will predict how that enzyme is going to behave if it has increased or decreased activity. And so these are often found to be reported on the reports, on these medication response reports, as an ultra-rapid metabolizer. That would be someone who has a significant or slightly increased activity in their enzyme. No increase in activity or no impact on activity would be typically, these reports will say you're an extensive metabolizer, so that's a normal metabolizer. Or your slightly reduced activity or significantly reduced activity is often going to be referred to as an intermediate metabolizer or poor metabolizer if there is elimination of the activity or a significantly reduced activity. So it just depends on what report and what lab you've gone with and how they do the reporting. So these particular changes in these enzymes are not to be predicted for all drug classes and all drugs. So it's very specific to the type of drug that you're taking. So subjects who have a no or slow rate of enzyme activity than a normal person would have higher circulating drug concentrations of an active drug. And this patient would be vulnerable to toxicity at a standard dose. So that would be for an active drug, a drug that's active before it's metabolized. So individuals who would have a faster rate of enzyme activity due to a mutation would have lower circulating active drug concentrations, and they may be subtherapeutic at a standard dose that's recommended. So that patient maybe would need an alternative drug or maybe an increased dosage of the drug. So that's an active drug. And like I said, not all drugs are affected the same way by mutations in these cytochrome P450 enzymes. Now, it's actually the opposite for what we call prodrugs. So prodrugs are inactive before they are metabolized. So they must be metabolized by cytochrome P450 enzymes before they become active. So the outcome's reversed for prodrugs that require this enzymatic activation. So your poor metabolizers would actually have a reduced amount of active drug in the blood, and they may be subtherapeutic at a standard dose. Whereas rapid metabolizers would produce too much active drug, and they would be vulnerable to toxicity at your standard dose. So you can see with these two examples between active and inactive prodrugs that you have the opposite effect. So it's important to not blanket statement that if you have a variant in a particular enzyme that you can predict how that enzyme will behave on all drug classes, because it really is drug dependent. So your medication response report, what does it look like? It's going to report the impact of each genetic change on an enzyme activity. So is that enzyme activity going to be increased, decreased, or normal? And then the result will also report out on a drug-by-drug basis. If a particular drug needs to be given at a standard dose, if it should be given with caution, maybe the patient needs an increased or decreased dose, or that an alternative drug should be considered completely. And again, it's very important to look not just at what the enzyme activity is, but each drug on a drug-by-drug basis. So pharmacogenomics should really just be viewed as a predictive medication response tool. So most drugs are metabolized by multiple enzyme pathways impacting the actual drug efficacy. So if you have a mutation that causes increase in activity, you may actually have a compensatory mutation in another pathway, or another pathway may be able to compensate for that change. And it should also be considered that lifestyle, diet, and other co-medications can impact efficacy. So it's not just what your genes say, but also these other non-genetic factors that can impact how you metabolize a drug. So really a combination of both gene testing and therapeutic monitoring should be used in individualizing drug therapy for a given patient. You should never just use pharmacogenetic reports, these medication response reports, in isolation. So I hope that this helps you to understand a little bit more about what these medication response or pharmacogenetic testing is, and that you're better educated. And if you think it's something that would be useful for you, talk to your physician about this type of testing, or send me an inbox message, or drop a message or a comment below, and I will help you to get the information that you need to make the best decisions for you. Thanks for tuning in.
Science education, feel this too. Molecular moms got it all for you.